Hi, Michael. Michael, I just want to let you know you're muted right now. So you can take yourself off mute at this time, or wait till we start the presentation. We'll get started directly at 12, but we are currently live streaming it. So
Okay.
um, we'll we'll get started soon. Do you have any
Can,
questions? You're all good?
I'm good. Can you hear me now?
I can hear you perfect.
Awesome. Okay.
Okay. Thank you. We'll get started soon.
Thank you for setting everything up.
Absolutely. Happy to help. Just going to give it another minute or two to let folks join the call. All right, we're gonna go ahead and get started there today, just in the essence of time. Miigwech merci beaucoup, and thank you all for joining us today for our Lunchtime Health Sciences webinar on private clinic efficiency and management. My name is Bethany Thompson, and I'm the Health Sciences Programs and Partnerships Coordinator at NASM University. And today's webinar is being delivered by Tabitha Supernov and Michael Belcamino. Before we get started, I will do a land acknowledgement and introduce both of our speakers. In the spirit of truth and reconciliation, NASM University respectfully acknowledges that our pan-northern campus is on the homelands of First Nations and Métis people. The university buildings we occupy in Greater Sudbury and Thunder Bay are located on the territory of the Anishinaabeg Nation, specifically Atikameksheng and Wahnapitae First Nations and Fort William First Nation. Beyond a land acknowledgement, we understand that reconciliation is a practice. We gratefully acknowledge the elders and knowledge keepers who share their gifts and teachings with us, so that we may better understand and honor their wisdom and that of all the traditional keepers of this land. NASM University will continue to practice reconciliation by listening, learning, and fostering a culture of mutual respect and trust. Just a general overview of today's agenda. This is a friendly reminder to please keep your microphone off for the duration of the webinar unless you are asking a question or responding to a question posed by the speakers. This will help limit background noise for everybody on the call today. This webinar is being recorded and will be posted on the Rehabilitation Sciences and Dietetic Practicum Program web pages. And all of our previous health sciences webinars are available on the NASM YouTube channel, and you can find these links to these recordings on our Rehabilitation Sciences and Dietetic Practicum Program web pages in the resources section on both. Excuse me. You can view these archive webinars at any time and receive a certificate for your professional development records once you complete an evaluation. If you do have any questions throughout the presentation, please feel free to put the questions in the chat. We will also have a monitored Q&A period at the end of today's webinar where our speakers will answer any questions that you may have. Tabitha and Michael will be speaking today based upon their own experiences working in a private clinic. Tabitha brings her experience of clinic management to this webinar and will focus on many factors in private clinic settings, as well as time management and efficiency. Michael brings his experience as a practicing physiotherapist and will focus on the aspects of private practice that can enhance one's work experience and ways to improve efficiency in specific physiotherapy assessments. I'd like to introduce everyone to Tabitha Supernov. Tabitha received her BA from York University and completed her BEd at Western University. She's the co-founder and chief operating officer at HealthTweak Incorporated and Tiny Fern Properties since 2014. Most recently, she assumed the position of Director of Business Development and Strategic Initiatives at the Sudbury Chamber of Commerce. She is also an ambitious, loving mom of 5. I'd also like to introduce Michael Belcamino. Michael's a physiotherapist partner in private practice and an assistant professor at NASM University in Thunder Bay. Certified in mechanical diagnosis and therapy, he is a PhD student in the joint PhD program at Lakehead University. And the verbose thesis dissertation is Mackenzie Therapist's Perspective of Physiotherapy, Clinical Reasoning, and Implications to Education, a Mixed Method Study. Thank you both for having you both on the call today. I'm going to pass it over to Tabitha to start the presentation on clinic management and efficiency.
Hello, everyone. Thank you so much for that, Bethany. That's wonderful. Hopefully today that you can gain an understanding whether you're a student or you're already a clinic owner, and hopefully I can give you some tips and tricks as well as, just some understanding if a student, whether you want to go into private practice or owning your own business as well, and help you out that way. So we're going to do, we did our introduction here, and we're going to do our multiple factors. Then I'll talk about some time management efficiency strategies, and then we'll save all the questions. I know Bethany had said just to the end after Michael's finished as well. Okay, Bethany, I did a great job introducing, but I always like to show my 5 crazy bunch here. It just kind of gives a perspective of, how I, have to stay super organized and efficient, not only at work, but also, in my home life too. We have a system for everything, and we break our time down and make sure everything is running super smoothly as best it can. And I know in, a clinic setting, or being an owner or being a mom, like things do not always go your way. But just trying to plan as best you can in those blocks to make sure that we're being as efficient as possible with the time limit you have of the day. Okay, I'll just introduce Health Tweak. We have been operating for over 10 years here in Sudbury. We are on 122 Martindale Road. Right now we have 4 physiotherapists, 3 chiropractors, 3 massage therapists, and 4 wellness assistants, which is our front end staff. And obviously always looking for more staff. This is, what we do in the North, always, on the hunt for more amazing physiotherapists or employees as well. Our values are patient-driven, and we like innovate, world-class, get to the root, and win as a team. And our purpose is to restore and maintain and expand human potential. Make sure everyone's living their best life here. Okay, Bethany, if you don't mind just switching to the next slide, and then we'll just hop back to that one. That's okay. Okay, I just want to talk about the multiple factors of running your own business. And I think, if you have a passion to do that, I think you should, and I hope not to scare you. And I know the clinic owners that are here, they get it. You're normally wearing several different hats, and even, Michael as a partner too, you have to take sometimes half of those hats onto yourself. And it's not necessarily that you're, extremely trained for some of these things and you're learning on the go. It obviously does get easier as, as the years go by, because then you've done it, a few times instead of just learning it once, depending on what you're doing in, whatever it may be in their business, whether it's marketing or HR, culture, or finances, or management, or building management. So I'll go into a few, and of course we would love questions too at the end. On maybe something I didn't say, or any, ideas that, or anything that you want to tip on or see what we do as well. So if you don't mind going back, sorry, Bethany. Yes, staffing. So obviously it's hard getting people to come up north. I think Sudbury is doing an amazing job in having Nossum there is fantastic to bring people up to the north. I mean, it's so beautiful, and this is what I sell all the time when I'm talking to universities, that, you know, you just can't beat the outdoors anywhere in the north, for sure. So, you know, really looking at, okay, do you have a partner to help in your staffing in general? So I'm going to go off my notes as well. Okay, and here I have, don't be afraid to try new things. At Haltwig, we've tried so many different things. We've had interviews that we've had multiple, you know, people come in to see, you know, how people chat with everyone and how they do this at group setting. So what I would say is, you know, be open to try new things when you're, you know, doing interviews or when you're recruiting staff as well, and seeing if it works, you know, and if it doesn't, then, you know, switch it a bit. What I've done that works really well is an, you know, a short online interview first, and it's like a 15-minute, you know, then you can see, you know, your potential new recruit, you know, and just have that initial 15 minutes to get those questions done and see if they've shown up and see if they've shown up on time, see if they're dressed appropriately. And that just gives you a quick snapshot. And it helps be more efficient as well, because you can, one, get through, you know, quite a few, you know, online interviews, and then be able to bring that to a, you know, an in-person interview. So that's something that worked for me, and it's been able to streamline a lot of my interviews that I do. The other thing is we like to ask, you know, really different questions and interesting questions to know, you know, to really get to know the person too. The other thing is what we've used as well is, you know, a little bit of, you know, personality testing too, to see whether it's going to be a good mesh in the clinic. We have all different types of personalities. So it's nice to see what's going to mesh with your clinic or in the setting, or even, you know, if you're going to be partners, you know, what kind of works for you. And of course, always have an HR person to call. You know, it's amazing, and it helps relieve some of your, you know, your stresses as a clinic owner, especially if you have a staff exiting or making sure you're just doing things properly in general. I'll talk about culture. It is very important, you know, to have your story and mission and vision and values to help, you know, focus your team that you have, so you guys are all on the same page. So what we do to, you know, for our values to help everyone, you know, come together as a team, we call it our Health Vader of the Month and Employee of the Month, and we do a $25 gift card, and our staff votes on, you know, what we've seen. So if it's, you know, member driven, they'll write down things that they've seen another staff member do, and it's just, you know, a nice way to appreciate, you know, your staff. They're there every day. They're doing, you know, life-saving things for our community. And I mean, I love my staff so much, and, you know, just to give them that extra thank you that I like to give them. Also monthly events, I like to do, you know, different things, and it could be, you know, it doesn't have to be something huge. It can just be something, you know, smaller, like at Halloween. Okay, let's dress up in costumes and, you know, have a little fun with, you know, our patients as well. And once our slide goes, and I'll kind of show you, I have a few pictures too. We recognize birthdays and anniversaries. Just, you know, it's, you know, we're here at work all the time. So to have fun and have a few balloons and blow out a few candles is something that I think our staff really appreciate. And, you know, as an employee or a person coming, you know, into your clinic, you know, it's just a, you know, another thank you. And what I like to say is happy staff is happy patients. You know, it really does trickle down. And I mean, without patients, you know, we don't have a business. So, and we don't have jobs. So, it's really important that we keep, everyone as happy as we can. Here's some of we just went curling for our Christmas party. So, we had a little lesson and went curling. That was great. I mean, that was my first time curling, so it was super fun. But this is our, Halloween, our costumes. We usually vote on, what we want to dress up as. So it's funny to see what comes to be, or, celebrating. We had someone that was getting married, so we threw a little something together. We have a Hawaii day where we like to dress up in Hawaiian gear. And, Christmas sweaters is something easy that you can do at Christmas time. And you know what, if you're joining a practice, let's say it's, maybe, ask if you can add some of these things just to make it more fun at work. Networking, I think this is super important for if you're a physio joining, somewhere to increase your patient load for sure. Or, a business owner for sure, or a partner. And leveraging your community partners. Here in Sudbury, we have a regional business center. They have some great things for business owners, and I'm sure they have that in every city. Just to help out and not make it so difficult. I know when I started a long time ago, they didn't have the programs that, they have now. And, it was a struggle a lot of the times to, figure out everything and who to call and who to ask. And there's definitely a lot of places out there now to help. The other thing is I work at the Chamber of Commerce, but this is also a great, resource for businesses to be able to connect with other businesses and just get your name out there. So those are two great things that, we've done, as Health Tweak, as, resources have grown in the city. Marketing as well. Make sure you get your brand out there. It's surprising to know that, after this long, still people don't know that you are here in Sudbury. So making sure that you, do things to get your brand out there. And make sure you try to figure out an audience that you're focused on most. I know we have pediatrics and pelvic floor physiotherapy at our clinic. So I definitely push that out and make sure that we're getting patients too. It makes our physiotherapists happy to be doing something that they love as well, to have that market. Management, that is a huge part of your day for sure. As a clinic owner, as a partner, you're still dealing with management, how to keep everyone together, everyone on, on time. You always need a system to follow. So whether you're hiring, a manager, you're still going to have to break down your systems in the clinic to make sure that someone is doing those tasks that you need done. And I'm going over a bit of an overview because I just would like to know, just to let the new, physios, when they're coming on in, that there's a lot to think about. And I wish someone would have broken everything down to me too before when I started. And it's, sometimes scary, but you will get through it and it'll all work out in the end for sure. The other thing I just want to talk about is building management as well. That's something that, whether you rent or you own your own space, there's always something to be fixed. There's always something in repair or snow removal or salting or damages, or that you just have to think about too and have, an open mind to, and who is going to be doing those things. Colleges, unlike other businesses, we are also governed by our colleges. For us, physiotherapy, massage, and chiro. So you do have to make sure that you are communicating with those colleges depending on what you want to do for patients, whether you want it just gives an extra layer of businesses. It gives it more restrictions than, you know, if you were just selling products, let's say. So keeping that in mind. Finances, absolutely keep your eye on those. It is, you need to know how many patients you need to break even and how to, you know, pay your, making sure your overhead costs are covered as well. So really breaking down those numbers. Excel should be your best friend. It's our best friend to make sure that we know, you know, where we are, and to make sure healthcare is, in my opinion, a tight margin. So making sure that you're using the best of your abilities to break that down, so you're not stressed as either a business owner or someone coming on in as well. Payroll and bookkeeping, yes. So too many hands in the pot makes it a bit messy. So making sure there's a system and leaning on technology as well. I've implemented a technology that can cover my, you know, payroll and HR and scheduling. So it covers a lot. So it's easier for me to manage as well, and lessens, you know, my plate and lets me have a lot of control. And so I can see everything that's kind of going on and happening. Okay, so I talked about factors. If I missed anything, or if anyone has any questions at the end, feel free to ask me. And then I know Michael's going to go in more detail, but I'll just talk about efficiency in caseload. For us, what we've like to do is ask a lot of questions about what you want to see in your practice and with your patient. How do you want your patients to feel when you're coming out? How do you want to feel? And how much time do you need? So looking at your appointment and really breaking it down to where and what you want to do and accomplish in that time that you have. And then what are other people responsible for? So if you have a front end staff, what are they going to bring the patient to you? Are you going to come get the patient? All those little tiny details really, really, really help in order to move forward and to be extremely efficient. You know, in my day, I like to kind of block book things, and I have, you know, what I want to do within that. Either you could, you know, break it down to 5 minutes, which in your appointments, I know, you know, you may only have 25 to 30 minutes or maybe even less. So what do you want to accomplish in that time? And really looking at, okay, so when a patient comes on in your room, do you want them to sit right on the table? So then you're not, you know, bringing them from the chair to the table and wasting that potential time that you'd have to already start your assessment. And Michael might have a different opinion too, because he, you know, I know it's difficult when you're, you know, working with patients, but trying your best to have, you know, a system as much as possible. And that will increase your productivity as well. So looking at your space, making sure everything is placed properly, so it's right there and organized and ready. I know we have, you know, little bins that we have at the clinic just to make sure everything is right there and available. We also have the opportunity to work in your rooms, so you don't necessarily have to go to the gym, and whether the patient's not feeling comfortable or anything, we can work in our room. So it's, you know, less time for us to walk to the gym and back as well. And then what are you going to do with charting? I know we haven't used AI yet to start like recording voices and trying that, but I know that is out there now to help with note charting. We try to use as many tick boxes as we can on our digital charting. And then when are you going to do that charting as well? Is it going to be right when the patient comes on in? Is it going to be, you know, you end 5 minutes early so you can, you know, get some of that done? Because I know that's, you know, a very pinpoint of a lot of practitioners to see when I'm going to do this charting and how long am I going to have to stay after work to get this completed. So trying to compile it in your day is definitely something you should do. And it definitely is great for the patients as well. I know a lot of people feel guilty about doing paperwork, whether it's, ending 5 minutes early, but, this is going to give the best care for the patient to have those notes completed and accurate as well. And okay, that's great. Thank you so much, Bethany, and Michael, take it away.
Thanks, Tabitha. As you said, that this does flow into Michael's presentation now quite well with the efficiency piece. So, Michael, you can go for it. All you.
Thank you, Bethany. First of all, Tabitha, that was awesome. I think what is very important, you talked about so many multifactorial components of private practice that students simply do not get, even when they're in placement in private practice or aware of it on graduating. There's many things that you brought out that are important, and I'm glad you brought it out. Okay. So I'm going to focus more on the physiotherapy patient assessment, and we could flip this slide, go to the next slide, please. That's for me. This we already know, and let's go to the next slide, please. So really what I would like to focus on, I'm going to discuss a little bit more about what private practice and how we can enhance our own experience, or the new grad or someone that's moved to Sudbury Thunder Bay and wants to experience it here, enhancing their work experience. Improving the efficiency of the physiotherapy clinical assessment with some strategies I'd like to provide that you could do within your assessment that doesn't take a lot more time, but would also add to your assessment, not just for efficiency, even from time, but getting to the root of the problem. And that involves the interview or the history taken of the patient, as well as the physical examination. Patient outcomes with improved quality care will build one's self-efficacy, especially as a new grad. We always have that sense, do I really understand this? And I feel like an imposter. I don't really know this as much as I should. But having success, seeing your patients do well, build self-efficacy, which tends to help retain clinicians to the profession, because that does happen. We do lose people from the profession because of that feeling that it's not what they wanted. You're also contributing to reducing the burden of illness on the individual, their family, and society. Next slide, please. So this is my background, and this is what I'm coming from. I've been around for a little while. In private practice, the whole time I've been a physiotherapist. In the last 13 years, I've been here as a partner with Walser. 2 years, I was a staff physiotherapist. I have 10 years experience in a bigger corporate structure. That was with CBI Physiotherapy and Rehabilitation, or formerly known as the Canadian Back Institute. There, I did disability assessments for the motor vehicle industry as an independent assessor. I did a few years as an advanced practice clinician with Isaac, which is now the Rapid Access Center for Spine. And I'm in my third year in the joint PhD program at Lakehead University, which has really helped me reflect a lot on what I do as a clinician, not just on what I'm planning to do as a scholar. Next slide, please. So lessons learned. So for new grads, and it's not, and it's just, and people that are moving to a new clinic, we're talking about efficiencies, but these are also important. If you're working for a big corporation, ask about those educational allowances and use it. Improving what we know and not assuming that you know it all and that you're always willing to learn. We are lifelong learners, will help you. What we did at CBI, which really helped efficiencies, we would schedule 1 hour once a week where all the clinicians would meet in the back room, and we would bring a chart. Everybody would have an opportunity. Can I bring this chart? And we'd discuss it. So that chart review, the patient, I'm trying this, I'm trying that, she's just not progressing. So we would have many minds contributing to try to help that clinician progress, which is great for a novice clinician because you have the opportunity to have a form of mentorship, as well as an experienced clinician where sometimes you just need a second set of eyes, okay? As a new grad, I would strongly recommend shadowing a senior clinician with a patient for 1 or 2 visits, at least once or twice a year. And I would even suggest do that up to 5 years into your practice. If you're going to go into a private practice situation, educational allowance is also important. This mentorship model, we've talked a lot about it in the physiotherapy profession, but to improve yourself as a clinician, whether it's efficiency of daily practice or just to be a better clinician, mentorship is an important role. If you can, with a more senior clinician or someone that's just simply been out there a couple years, is meet with them once a month with a difficult case or just simply a case that has worked for you. It allows us to retain our clinicians because there's a feeling of cooperation and cohesiveness. We have a open door policy, literally knock on the door. Do you have 5 minutes? I'm having a difficult time with this patient. Or would you mind looking at this patient's knee for me? I think I see something. That open door, again, helps with everyone's efficiency and everyone's learning. I strongly, and again, this is coming more from my studies now, believe in self-assessment. Finding, and there's many ways to do so, but asking yourself during the assessment, at the end of the assessment, what did I see? Am I truly giving the appropriate treatment for this patient? What do I expect to happen when the patient comes back? If the patient comes back and is worse, what should I do? If it's better, what should I do if there's no difference? These mini self-assessments improves your efficiency as a clinician. The clinical goals should be the patient's goals, not our goals. They should be in a collaborative effort with them. And we should be looking at our own, what is my life goal as a clinician? Be open to feedback from your colleagues and even from yourself. The assessment and treatment of patients over the years improves your efficiency of clinical assessment. That ongoing reflection and self-assessment helps you become better at assessment and treatment, which improves your clinical efficiency. Next slide, please. So what can we do? First of all, in the history itself, I'm McKenzie trained or mechanical diagnosis and therapy therapist. We use a standardized form which has closed as well as open-ended questions in that form. Sometimes, although it may feel like you're not efficient with time, you have to allow that patient with an open question, not that they're rambling, but they're providing you their narrative, their history. We don't want to force, well, is it pain you feel or is it not pain you feel? Don't give them your coding. Listen to them. If they say, I feel tightness, I feel heaviness, use that as part of your assessment to determine a baseline for future reassessment. So those open and closed questions helps provide you better insights to the disorder. Active listening. Don't complete their sentences. Don't try to finish. Actively listen and confirm. So by this, are you saying the pain is worse while you're sitting? No. It's when I stand. So while you're sitting, it's not worse. Correct. It's only when I stand from prolonged sitting is it difficult to stand. So that active listening, clarification, confirming the narrative you're hearing is very important. As part of the Cochrane database, and this is open access to everybody, a lot of the national medicine, both in US and Canada, is open access, which is fantastic. This information's there. So from Cochrane's database, and every reference is at the end, there is a reference list. Patients, as part of our efficiency, we should be thinking always with every patient that walks in, not to assume that everything is fine in their health. So the red flag questions, the history of cancer, and that is the big one, is the unexplained weight loss. Previous history of cancer, think possible cancer could be coming back. Unexplained weight loss, think cancer. Bowel and bladder, asking specifically, do you have control of your bowel, control of your bladder? Because if you don't ask that, you're going to get a history of constipation and frequent, like, it's the bowel bladders, we're thinking cauda equina. History of trauma. Is there a possibility of a fracture? In the young, take care. In the old, beware. Because if there's trauma in the young, we're going to take care. They're pretty resilient, but we want to make sure that there's no growth plate fractures possibility. In older, beware. Is there a fracture that we're not aware of because the bones are a little bit more brittle? So as a general rule, if they're over 50, those are questions we're thinking of. Next slide, please. During the physical examination, be aware of potential clinical reasoning errors or cognitive biases. And again, this is a big part of my dissertation, because this can influence your assessment and management of the patient. And now these biases could be overt, could be implied, could be self-conscious and not even realizing you're doing it. So clinical reasoning error is inadequate reasoning affecting either the assessment, diagnosis, and the treatment of the individual that you have in front of you. A cognitive bias is systematic errors in thinking which can directly or indirectly influence the decision making with your patient. Next slide, please. So the three ones we tend to see in the clinic, and as I mentioned this, you might be experiencing some aha moments. Anchoring bias. You're listening to the patient, you focus on one of the salient features of the patient's presentation early in the reasoning process, early in the assessment. I'm doing this because I'm imagining a patient is sitting in that chair. That's why I'm doing this. I apologize. And you focus, you anchor your reasoning on that, and failing to adjust, even though evidence is disputing what you're thinking. An anchoring bias can happen at the best of times. It can happen with an experienced clinician. It can happen with a very novice clinician. Extrapolation error is generalization of treatment or experience of patients, and you assume this with all your patients. So a patient presents with mechanical low back pain. Oh, all my patients, they respond to extension. You just need to you're going to need extension because it hurts when you sit. So you're extrapolating the treatment on this patient without thoroughly doing a proper assessment or determining your thought process and assuming everybody's the same. Zebra retreat, the third common clinical error, is really an error of self-confidence or self-assurance. You want to do a particular movement, or you think you see something that is rare, but because you don't see it, you move away and you err on the side, well, I'm going to just do something that I know is not going to harm the individual because I'm not really confident that what I'm seeing is truly what I'm seeing. So that affects the patient in a number of ways. One, if it's something that needs to be addressed, let's say it's mechanical low back pain and it's a significant, more lateral disc herniation that would respond to a maneuver where we take the patient into flexion and rotation and apply overpressure, which you don't have the confidence in doing because I've only done it once and it was during the examination, during my OSCE, and you might be depriving the patient of a technique that might reduce the problem and prevent them from becoming a surgical candidate. Equally worse, if we don't do it and the morbidity continues, then the compound factor of dealing with chronic pain and affecting the family, affecting psychology, all those because you fear that you don't want to use that technique. And conversely, if you see something and you suspect, man, I really think this patient might be having cauda equina syndrome, but you know what? I've never really seen it, so I'm going to wait another week. Then potentially this patient may never have the ability to control the bowel and bladder the longer we wait, because we know cauda equina is a medical emergency. And these are just three. There's many. And errors and biases can overlap. You can be extrapolating one thing and anchoring on this one part of their assessment. So these are just three of the most common. And again, I've given you the references for that. So what are strategies to mitigate which are going to improve your efficiency? So we talked about things to do during your interview, during your assessment, questions to ask to make you improve your efficiency as a physiotherapist in assessment. During the process of assessment and treatment and reassessment with ongoing patients, Riley, who's one of the authors in the textbook written by the American College of Physicians on reducing clinical reasoning error and cognitive bias, they suggest 4 questions to ask oneself. When I'm looking at the patient and we have the ongoing collaborative discussion with the patient, ask yourself, what else could this be? Do the findings fit the diagnosis? Yes, this is a rotator cuff tendinopathy. But every time the patient turns to the left, he gets a sharp shoulder pain. There's a depressed reflex. There's weakness of the myotomes. Do the findings really fit the diagnosis that I've come to arrive at? Could there be multiple things going on? Is it possible that this patient does have rotator cuff tendinopathy and a radiculopathy from his cervical spine? So this isn't the textbook in our classes or in our cases when we're doing our university preparation. In the real world, patients come in with multiple things, remembering that. And a big one, especially it's 5:30, you're on your last patient, 6:15, you got to pick up your kids at daycare. That's going through your mind. And you say, okay, this patient, you're telling me information I don't need to know. Okay, get to the point. Your mind is saying that, you don't want to say that. Is there other factors, your factors, that you need to slow down? Is there reasons why you slow down and your reasoning is being affected? And conversely, if the patient very anxious and is all over the place, are you speeding up because they're speeding up? So remembering that our reasoning errors could be of thinking, could be of not enough preparation, not enough of our clinical knowledge, but it can also be effective behavior of yourself or the patient. And that brings me to the last slide, which is the references. And I also made a note in respect of trademark. Any images that were not stock images are referenced to respect the authorship and the producers of that information, that it's their work and not mine. And that's it.
That's great. Thank you so much, Michael. Lots of great insight there in terms of the physiotherapy assessment and how to prepare yourself as a new grad and going out into that workforce. So thank you so much. I'm going to open up now for everyone. If you have any questions, feel free to take yourself off of mute or post them in the chat.
Hi, everyone. Really appreciate the presentation. Just had a few questions. Curious to know what CRMs you guys are using in your practices. We use Jane at our practice here.
We use Giovanno in ours.
And we use Practice Perfect.
Okay. What about payroll systems?
Yeah, so I had just switched over all mine to, it's called Rise, the company in British Columbia.
And we use Sage, and one of the partners does all the payroll, and Sage is updated yearly, and we use a bookkeeper as well as an external accounting firm, and every year we do a review with both.
Okay, great. We use Humi, if anyone's interested. I was actually looking at Rise as well. I think they're very similar. Definitely been happy with that over the last 2 months since we've switched. in terms of financial planning, what does your kind of end of year financial planning strategy look like?
It's a great question. We, yeah, obviously budget it on, the year before. I hand my finances over to my partner that runs with me. So he's responsible for all that and giving me numbers for what, I can do for next year in regards to marketing or networking or, and he breaks that all down for me. So
I'm one of 3 partners. We meet and have a partners meeting every 2-ish weeks, except sometimes in the summer, just because of vacation. Sometimes it becomes once a month. We look at year to date. We look at where we are in the month, and it's ongoing. We know roughly what our targets are. Our goals is that everybody has a quality of life and a good living with this. It also allows us to sort of forecast. We have not gone a year, even during the COVID years, which seem like a bad dream now. We always have allocated funds for educational development. During COVID, some of that educational development had to be done online with some of the coursework. But on an ongoing basis, we know where we are monthly so that it's no surprise at year end.
absolutely.
Okay.
We also know where we are monthly to make sure everything, and I think that's what you have to do. There's influx of patients to know where you are and how many new patients do you need and how many patients do you need to break even, all those information. And it should be updated so you know that, at least monthly.
Are you so I'm curious, what's your number like per therapist? How many clients do they need to see per day for you to be, break even, profitable?
Yeah, I think that would be, you're more than welcome to email me for sure. But I think it
Fair
just
enough.
depends on, what model are you using for paying, staff as well. How much are you paying,
Yeah.
your staff? How much do you charge for your, each patient? So that is going to vary depending on, what you do in your clinic.
Right. Fair. In terms of
I wouldn't
marketing,
add
what are you guys
anything.
doing from? Oh, sorry.
I wouldn't add anything. I think Tabitha addressed it quite well. Thank you.
Okay. Yeah, in terms of marketing, are you guys trying to grow your practices? Are you happy with the number of clients that are coming in every month? If you are trying to grow, what sort of marketing strategies are you using?
I think, as a business in the North, I think you should always be looking at, growth and where you at. I know we all hit COVID and, things had to change a bit. And, for marketing, I love to try new things and be different. And, one of our billboards, if you hadn't seen one before, it was super funny. They all had done the Zoolander look on the Kingsway and saying that, we take your pain seriously. But, I like to come up, whether I get some suggestions from staff or, what, we should do. We like to be there for the community too, doing things, sponsoring or donating as well, and just getting our name, out there. There's tons of events in Sudbury that you can do and use and things that we can help support our community as well. And that helps with your marketing for sure.
Yeah, and we're in a unique situation. Thunder Bay is Marcus Walser is one of the partners, Emery Mige is the other partner, but Marcus is the founder of the clinic, hence it's Walser Physiotherapy. And we've been here 25 plus years. It has taken us almost 2 years to hire one physiotherapist. That's how short we are. With respect to marketing, we're trying to get our waiting list down. It's better now. It was 4 weeks for a new assessment. So looking for patients was never really an issue. For 5 years, I was the chief volunteer. We volunteered our services with USL soccer team, and our name was on the billboard every game. We also contribute back to the community, sometimes clandestinely, like with, we donate to this. We try to balance it off, whether it's the shelter house or when we had the Special Olympics, we volunteered our services, and Marcus was actually a key coordinator with that as well. So we do things, I guess, that are marketing, but also respecting we are from Thunder Bay, we live in this community, and we have a social obligation to put some stuff back to the community. If it comes good at marketing, great, but it's also, fortunately, the three of us have the same mindset, which we really didn't talk about in terms of private practice, but I think it's important, is giving back to the community we live in. So.
Okay, great. Thank you. I'm in Sault Ste. Marie, by the way, and we have the same problem. We've been trying to hire another physio for over a year. We're really hoping we get some students at some point soon. But I guess the last question, in terms of SOAP notes and charting, have you guys used any of the AI software?
No, we haven't. And I heard that it is coming along quite well. So I'll probably start to try and see where we can, just experiment on that a little bit, hopefully in the next, probably next year.
Yeah. We don't. Most of the clinicians, one of our clinicians, she does all her note-taking right on Practice Perfect and allows you to do that as part of scheduling. She does primarily pelvic floor, and she prefers that because it has more security for some of the stuff that she's writing. My bias is cognition and learning, and I would love to argue that AI is a good way to lead you down the wrong road. I have some colleagues who are using AI, and I say beware of the trap that AI can begin to hallucinate. At the OPA conference last year, there was a few talks on it. The important thing is you have to embrace it, because it's either a train we're going to try to jump in front and get run over, or we have to jump on board. And that's not my quote. That's an AI expert from CBC. So we haven't used it. I think it's important to be aware that this generation, I have 25 and 21-year-old sons who our sons have both used it in school with different things. I think it's important to understand what's there, because you have to be careful that AI might bring you down the wrong road. So that's just my complete bias from my perspective of AI.
But I would say, before like going in that route, like looking at all your questions and seeing what can be, because there's like tick boxes you can do, there's, and asking, as a group, we're always big on, asking everyone, what can we do to make this, easier and lesser of, time to do this charting, to make sure it's accurate as well. So yeah, hopefully that helps. And I know trying to, students, for sure, having a student would is great for the clinic. That's what we've used to be able to get staff up here in Sudbury, but don't be afraid to reach out to their college, the universities. I know they do little, recruiting, like, for staffing and everything. So that is something that we've used as well to try to recruit.
Carson,
Okay,
if I can
thank you
add,
so much.
Carson, if I can add 2 points, is we're really lucky with NOSM having the ability for majority of our McMaster students doing a placement here to win over the students that the North is actually a pretty good place to live. You could be home in 10 minutes, you could be fishing in 15, and you can canoe through the city on a natural river. So very much like Sault Ste. Marie, Thunder Bay is, and I played soccer in that Sioux tournament many, many years. I understand how you guys are. So I think that's really good for, especially if they're from the Sioux and they're students in at Queens or McMaster, whatever, if you can have them do their placement with you, it helps with retention. Secondly, efficiency in practice. A good reference, Jensen is the lead author, Gail Jensen, Expertise in Physical Therapy. The book, there's the 2007 edition, and there's also the book where Mussolino and Jensen, and those are on my reference list, both Jensen and Mussolino, on clinical reasoning. In expertise practice, your efficiencies improve. You can get a lot in that 15, 20 minutes from your history alone and may only need 5 minutes during your physical exam to confirm. So the term we're moving towards in terms of expertise practice is expertise performance, trying to perform expert practice with every patient. And they are huge references. They're well written. I could not say enough about that as a good start, regardless of the clinician, novice, or expert, or
Okay, great. Thank you.
That's great. Thanks for all those questions, Carson. Lots of good discussion on the chat today. Does anyone have any last questions for Michael or Tabitha? I know we're short on time now. We're getting near the end of it.
But I would say, Bethany, and I'm sure Michael, would agree. If anyone wants to reach out, we'd have no problem, answering any further questions through email. We've all been there, once, and we'd love to help, navigate anyone if they need help.
I was just going to comment that on the evaluation form that everyone who's invited will complete, there'll be an opportunity actually to indicate any interest that you might have in an interest group on this topic. And running a clinic obviously is very complicated enterprise, and I think there's a lot of opportunity to learn from one another. We're running clinics in Northern Ontario, and this conversation was a great example of some of the insights that could be shared. So I just wanted to thank you both for the presentation today.
Thank you so much.
Thank you for having us.
Great. Awesome. Thank you both for the presentation today. Lots of great insight. I've learned a lot. I had a good appreciation that it was a busy undertaking and running a clinic, but you've really, I think, pulled the curtain away and really shown the nitty-gritty and the stuff that, like you said, you don't get to see as a new grad, or you don't learn about in the school piece of it. So thank you both so much for that today. And anyone on the call, I'm happy to connect you with Tabitha and Michael should you have questions. And thank you all so much.
I want to say again, I think what Tabitha introduced is underrepresented in education, that whole business aspect. They're moving towards it, but I think this is very important, for future students if they want to look at this recording. Those are important aspects of private practice. So.
Absolutely. That's great. All right. Well, thank you both, and thank everyone for joining the call today, and I hope you all have a great day.